Hi, my name is Roza Hirpa, and I'm going to demonstrate how to do a basic IV insertion. My doctor has ordered that I give my patient a blood transfusion, so I'm going to be using a 20 gauge needle to administer that. I'm going to check my doctor's orders and check my standard protocols to make sure that everything is right. I have all my supplies ready. I have my 20 gauge needle and my catheter. I have my tourniquet. I have my tubing, my alcohol swab, my saline, my syringe, tape to secure the IV, gloves to keep this a clean technique, and I have my stairs. Okay, and before I go into the room, I'm going to check any labs on any allergies that my patient may have, and I'm also going to wash my hands before I touch any of the equipment. I'm going to apply my gloves. I'm going to remove the cap. Before I do that, I'm going to clean the top of my vial. I'm going to remove the cap. I'm going to then aspirate 3 milliliters because that's how much I need to flush. I'm going to draw that up. I'm going to put the air in, draw up my 3 milliliters, throw my needle in the sharps. Now I'm going to open up my packet, put that on my tubing, and I'm going to run it to prime it just a little bit, and you can see that I did because there's fluid coming out. So now I'm just going to cap it off and place that back in my bag so that it's clean. And now I have all my materials ready, so I'm ready to go into my client's room. I'm going to check my doctor's orders again to make sure that these are the materials that I need and this is the procedure that I'm doing, and I'm going into the right client's room. Okay, you follow me? Alright. Now I am in my patient's room. I'm going to knock. I'm going to wash my hands, and as I'm doing that, I'm going to identify myself and I'm going to identify my patient. I'm going to use 2 identifiers. I'm going to ask for the date of birth and their name. I'm going to check that with their ID badge, and then I'm going to talk to my patient, educate them about why I'm there, why I'm doing the procedure, and that they're getting a blood transfusion, and the supplies that I have, the gauge of the needle that I'm going to use, and that everything that I'm doing pretty much so that they're not confused in the process. So first what I'm going to do is I'm going to assess the site to make sure that there's no phlebitis, there's no inflammation, no redness. I'm going to ask my patient how they're feeling. Okay, they're good. Now I'm going to put on my gloves, and then I'm going to ask my patient which one is their dominant hand. I'm going to ask them if they have any allergies. I'm going to make sure that they don't have a mastectomy or any previous IVs on that hand that's running, or any previous surgeries that they've had, so that it doesn't collide with the blood infusion that I'm about to give them. So then I'm going to palpate again and make sure I have a really good vein. I'm going to assess the radial pulse. Okay, I have found a vein. Now I'm going to put on my tourniquet. I'm going to apply it 4 to 6 inches above my site. And before I tie it, I'm just going to clean my site off with alcohol swab. And as that's drying, I'm going to get my needles ready. Okay, I'm going to tie the tourniquet. Okay, I'm going to reassess the radial pulse. Everything seems good. Okay, now I have my catheter in my hand. I'm going to hold the skin taut to unclamp the blood first of all. Okay. Alright, I'm going to hold my skin taut. I'm going to go in at a 15-degree bevel up. Make sure that I get a flashback. And we're going to say that I got a flashback. The blood's not working. I'm going to then release my tourniquet. And then I am going to advance my catheter while removing the needle. I'm going to throw that in the sharps. And immediately I am going to attach my tubing. Okay, and then I'm just going to unclamp it. And then I'm just going to aspirate first to make sure that I have blood return, and I do. And I'm just going to push in, going slowly. I'm going to be observing for any bumps or bruising that occur to make sure that there's no complications. Okay, and as I'm pushing down on my syringe, I'm just going to clamp off my tubing so that I have positive pressure. Okay, and I'm going to remove this. Throw that in the sharps. And then I'm going to get my tape. Apply one down here. And apply another long piece of tape above. Making sure that nothing is irritating my patient. Now I'm going to take my sterile dressing, take it off, and then I'm going to apply it completely around the site, covering it, making sure that I don't cover my tubing. And then I'm going to take that off. I am going to then document the date, time, the gauge that I used, my initials on the sterile dressing, and then I'm going to document my patient's response, the education that I gave my patient, how my patient tolerated it, the arm that I put it on, the attempts that it took me to put my IV insertion in. I'm going to then educate my patient about what's going to happen, and then I'll tell him I'll check with him periodically. I'm going to do my 4 P's, which are the patient's position, if they have to use the restroom, their pain level, and their position, and their personal stuff. I am then going to clean off everything and leave, and that's the basic IV insertion.